There are four key stakeholders in healthcare today, and that means these people are looking at healthcare through a different lens. They're wanting something different from healthcare. The first one would be patients. Patients want proper care. They want professional care. They want it to be affordable, and they want it to be timely. Providers, these are going to be your doctors and hospitals and other medical providers. What do they want to do? They want to practice medicine. They want to take care of people, and they want to be paid on time and without a lot of hassles. The third would be the policymakers. Now, this is Congress. This is the Congress and the Senate who are trying to make sure that this healthcare system is working, that it's effective, that's efficient, that it's also affordable for the government. And then lastly, we have payers. And this would be the insurance companies. And they really have one primary goal, and that is to make a profit. And so what's going on right now in healthcare is that the policymakers, the Congress, are saying to the payers, you are abusing the system, specifically through the Medicare Advantage plans. So the policymakers are saying to the payers, we're going to have to make some changes. And what I'm going to do in this video is I'm going to show you the 4 Medicare changes that are finally being demanded by Congress. Now, the 3 policymakers that are leading this effort right now are actually 3 U.S. representatives, and so I wanted to make sure you knew who they were. First off is Pramila Jayapal. She's actually a U.S. rep from the state of Washington. And then we have Rosa DeLauro, who is U.S. representative in Connecticut, and then Jan Schakowsky, U.S. representative from the state of Illinois. And these ladies are actually leading 60 lawmakers in calling on the Centers for Medicare and Medicaid Services, CMS, to enact urgent reforms to Medicare Advantage plans specifically. Unlike traditional Medicare, MA plans are administered by private health insurance companies and have been found to be fraught with waste, fraud, and abuse, oftentimes sacrificing patient outcomes for higher corporate profit. And so just want to read a little bit more about what these members had to say. They said corporate health insurers offering MA plans, Medicare Advantage plans, are harming vulnerable patients across the country and endangering the solvency of the Medicare trust funds. Supporters of the MA claim the program reduces cost. Unfortunately, the MA program has never saved the government any money. And so I'm going to get into what these reforms that are needed. But before we do, I just want to lay the foundation and talk about, first off, the problems that are soaring right now, why it is that these 60 lawmakers are trying to do something about Medicare Advantage plans right now. First off, higher cost. As this just said, MA originally said we can do this at a lower cost. That has not been the case whatsoever. Poorer care, you'll see me share some illustrations about that. Misinformation, misleading claims by the Medicare Advantage companies, and then the solvency of the Medicare Trust Fund, meaning the impact that their profits is now having upon the solvency and the longevity of Medicare into the future. Now, what I want to do before I get into all that, I just want to read a couple comments to you that I thought would be really helpful from not just people that are in Congress, but also authorities and experts that are in the Medicare field. Here's what this gentleman said. His name is David Lipschitz. He's the Associate Director for the Medicare Advocacy. Here's what he says. For too long, Medicare Advantage plans have been significantly overpaid with too little to show for it. At the same time, barriers to care that people face in traditional Medicare are often exacerbated when one is in an MA plan. Means there's additional requirements for someone that's going to be in the Medicare Advantage plan versus traditional Medicare. This lady, whose name is Diane Archer, she's the president of a group called Just Care USA. Here's what she says. Right now, the government cannot protect people from joining Medicare Advantage plans that endanger their health. And Medicare Advantage is driving up Medicare premiums by tens of billions of dollars a year and compromising the Medicare Trust Fund. This is a gentleman whose name is Dr. Gillette Singh. He's an MD. He says, as a physician and especially as a gynecologic oncologist, I have personally seen the damage that corporate-controlled Medicare Advantage plans can do to patient care. Narrow networks, onerous prior authorization requirements that lead to needless patient suffering and damaging delays in treatment, all in the name of providing more dollars to insurance companies. This person, Nancy Altman, president of what's called Social Security Works, here's what she says. Many Medicare Advantage plans are bad actors who rake in profits by delaying and denying the care seniors and people with disabilities need while overcharging the governments to the tune of $140 billion a year. Those plans should be called Medicare Disadvantage. The Medicare Advantage program, this doctor says, Dr. Jamila Headley, executive director of an organization called Be a Hero, says this: the Medicare Advantage program was created 25 years ago with the promise that the private sector could reduce cost by better managing care. But instead, it has become a shameless profiteering scheme. Through waste, fraud, and abuse of the rules, insurance corporations will be overpaid by taxpayers at least $88 billion this year, all while wrongly restricting provider networks and denying and delaying care for many older American people with disabilities. This letter that I'm going to go through here next prescribes urgent solutions. This is a letter that I'm going to go through next. This is a letter from these lawmakers to Medicare. This letter prescribes urgent solutions to these pressing problems. Most critical among them is the need to reclaim the billions of dollars gouged from taxpayers by large insurance corporations, and instead of being gouged, she was saying, instead of this, investing these precious resources, government funds, into improving Medicare and ensuring that this vital public program is there for generations to come. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. Now, in regards to these particular problems that truly are soaring, these congressmen now are addressing this issue, and again, we're going to get next right into those exact reforms they're calling for. But I just want to read kind of the introductory parts of this letter to, which is going to President Biden, going to the Department of Health and Human Services Secretary, as well as the leader of the CMS program. So here's what they write, and really listen to the sobriety of this, the soberness of this situation. Here's what they say: we write with grave concern that corporate health insurers offering Medicare Advantage plans are harming vulnerable patients across the country and endangering the solvency of the Medicare Trust Fund. They go on to say, we urge you to consider continued efforts to address remaining issues with the program by making it, here's the goal, number 1, easier for beneficiaries to receive care, and number 2, ensuring funds that are incorrectly going to Medicare Advantage plans are then redirected to patients and providers and modernizing the benefits in traditional Medicare. So that's their goal, again, addressing these particular problems. Let's go on. It says this. They say, supporters of MA, Medicare Advantage, that program, claim that that program reduces cost. Unfortunately, the Medicare Advantage program has never saved the government any money. In fact, spending per beneficiary is growing faster in Medicare Advantage than in traditional Medicare. And the Medicare Payment Advisory Commission, which is called MedPAC, estimates that CMS pays Medicare Advantage plans 6% more per enrollee than it would cost to cover them, that same enrollee in traditional Medicare. Folks, we're talking about hundreds of millions of dollars, probably billions of dollars extra now because of the MA program. And they go on to say this: despite these higher costs, the data demonstrates that MA often provides worse coverage, higher cost, poorer care than traditional Medicare. And then they give a couple of really sobering examples. For example, a recent study found that people in MA plans, Medicare Advantage plans, are significantly more likely to die in the month following surgery for stomach, pancreatic, or liver cancer compared to those that are in traditional Medicare. Other recent data has shown that the bottom 5% of Medicare Advantage plans, listen to this, folks, are responsible for 10,000 preventable deaths every single year. I've seen that in my own practice, where a man had to be discharged from a skilled nursing facility by a Medicare Advantage company, and he passed away. His wife said they sent him home too early and just needed the care of that skilled nursing facility. But again, he was discharged. So those kind of things are happening. Let's go on. It says here, in the light of this troubling trend of higher cost and poorer care, we believe it is essential that older adults, people with disabilities, and lawmakers and administrators, again, patients, providers, and the policymakers that are regulating Medicare recognize, again, misinformation disseminated by private insurers. For example, they say a report by CMS recently showed that contrary to insurers' claims, Medicare Advantage plans drive health inequities. Black, Native American, or Alaska Native and Hispanic Medicare Advantage enrollees have lower clinical quality scores. In other words, the outcomes of their health care on Medicare Advantage is lower than what it should be. They go on to say this. Studies also show that while the number of Black, Asian, and Hispanic enrollees in Medicare Advantage has grown over the last several years, those communities continue to be offered and enrolled in plans with lower quality ratings. Again, more misinformation. In the past, here's what they said. Private insurance companies have stated that they will be forced, now listen to this, that they'll be forced to cut benefits if the government stops the overpayments these companies have collected for decades. In other words, they've been getting much more than what they really needed or even deserved. And now they're saying if you cut these back, that's going to have a bearing upon those that are enrolled in Medicare Advantage plans. But these congressmen said that is a false narrative. It is misleading. Here's what they said. We believe that curbing overpayments to Medicare Advantage plans would, however, rein in excessive profit margins made on the backs of taxpayers, which have allowed private Medicare Advantage insurers to more than double their profit margins per enrollee. So what they're saying is we really want to protect our profits, and we're going to disguise this as though we're going to have to cut back on benefits. So it's a false narrative. Furthermore, we understand that when beneficiaries realize the disadvantages of Medicare Advantage and wish to switch back to traditional Medicare, they often struggle to enroll and frequently do not qualify for supplemental plans like Medigap policies. Okay, why? Because they have to qualify medically to get off their Advantage plan and to get on a supplemental plan. And here's what they say. Effectively, what happens when people would like to get off Advantage and go to traditional Medicare and get a supplemental plan, effectively, they are being trapped in their MA plans that are no longer serving them. We believe that the false promises of Medicare Advantage plans hurt beneficiaries even as they seek to leave their MA plans. All right, so it's clear. Lots of problems. And those problems continue to get worse. Now let's talk about what these Congress representatives are asking for. Here's the reforms that are needed. I'm going to take them. There's actually 4 of them, and we're going to break these down in this letter. The first reform is this: to ensure that insurance companies do not prevent Medicare recipients from getting proper care by putting up obstacles. Those obstacles, as you will see in this article, in this letter to them, obstacles are prior authorizations, obstacles such as networks. So there's different things that stand in the way of people getting proper care. So let's go through it. Here's what they say in point number 1. They say, we applaud CMS's recent actions on insurer tactics that we believe limit care and aim to increase the Medicare Advantage companies' profits. Specifically, we appreciate CMS prohibiting insurers from imposing additional clinical criteria for prior authorizations outside of current Medicare policies and streamlining the prior authorization process. This actually just went into effect this year, and they have a long way to go. And clearly what they're saying is that we want you to enforce the rules, and that means this: making sure Medicare Advantage plans cannot go above and beyond just the normal Medicare criteria for something actually being covered by Medicare. They would add extra steps, prior authorizations, and they would stand in the way of care that Medicare would give, and Advantage plans did not want to do that, and so they made it very cumbersome for people to be able to get that care. Let me keep reading. If enforced properly, and I think that's the key here, folks, the legislation is there and the rules are in place, but the problem is they don't enforce it. They haven't in the past. This has been going on 20 years now. If enforced properly, these actions could decrease the roughly 260,000 medical prior authorizations and the 1.5 million payment requests that are improperly denied by Medicare Advantage insurers each and every year. Listen to this. By enacting these and reinforcing these, they're saying this: 97% of medical practices recently report, they're talking about doctors and specialists, they reported that their patients experienced a delay or denial of medically necessary care as a result of prior authorization requirements imposed by private insurers. Further, they say 86% of physicians have reported that despite insurer claims that prior authorization is intended to contain costs, in other words, there's a reason for it, they're saying such tactics actually lead to higher healthcare utilization and waste. For example, insurers may require extra diagnostic tests to confirm, in quotes, the diagnosis a medical provider has already made. In other words, the doc already knows this is what you need, and now because you're on this Advantage plan, now we're going to put an extra requirement in there to really confirm it, to give them an opportunity to deny it, is what they're doing. Cracking down on prior authorizations, they write, could reduce physician and hospital overhead and physician burnout while saving taxpayers dollars. And they say this: we urge you to consider strong enforcement of these regulations and meaningfully penalize plans that do not comply. And just so you know, some plans do comply, but there's a lot of bad actors within the Medicare Advantage system today. They also say we encourage CMS to scrutinize private insurance companies, now listen, that use artificial intelligence to make coverage decisions and erect barriers to care. Artificial intelligence, algorithms are being used to make decisions instead of just the physicians themselves. Some medical providers have said that these algorithms misapply Medicare coverage criteria, again, go above and beyond the original Medicare rules, resulting in inappropriate denials of care. Indeed, there are many harrowing reports of patients with MA coverage who were denied care for stroke recovery, forced into dangerously premature discharges from their hospital stays, and I know skilled nursing stays, and more, all because an arbitrary artificial intelligence algorithm told the insurance company that the care should be denied. They write, sadly, it appears that Medicare Advantage insurers also use restricted networks to create additional obstacles to care for beneficiaries. All Advantage plans are going to have a network. It's going to be an HMO or a PPO plan. Research has found that patients enrolled in MA plans who had lung, esophagus, stomach, pancreas, colon, or rectal cancer, listen to this, were 5 times less likely to receive care at a national care institute that's designed to be a cancer center. 5 times less. Why? Because they're not in that HMO or in that PPO network. Well, go on. They are 3 times less likely to receive care at a teaching hospital and almost half as likely to receive care at a Commission on Cancer accredited hospital because the insurer running that plan excluded these top-tier hospitals from the network. Mortality has also been shown to be significantly higher for Medicare Advantage beneficiaries with stomach, pancreas, and liver cancers than comparable, again, to traditional Medicare. They say we find that even when Medicare Advantage enrollees try to find in-network providers, they must rely on plan directories that often contain numerous errors or list providers who are unreachable or are unavailable. These ghost networks, they call them, make it even more difficult for a beneficiary to find care. So what they're saying, this is a problem and this needs to be fixed. And we want you to be serious about fixing the problem. If you're finding this video to be helpful and you would like to learn more about Medicare, you'll notice up here in the right-hand corner, there's an eye. And if you'll click on that eye, it's going to take you to a 20-minute workshop. I see people make mistakes all the time, and we don't want that to happen to you. And that's why we're giving you free access to this workshop. So go ahead, click the link, and learn more about Medicare. All right, now let's go to the second reform that Congress says is needed. And that's this. This is read it together. To strengthen data collection and transparency to improve public understanding of, watch this, of the effects of these MA plans that we'll have on patients and the whole Medicare program. In other words, there's a lot of things that are hidden by these Advantage plans. They're saying, hey, we need more data. We need this information to be available so people can actually see what is happening within their plan. Here's what they say. We believe that CMS, Center for Medicare and Medicaid Services, data collection practices in MA, it is flawed, making it difficult for policymakers and regulators to oversee the program and legislate potential reforms adequately. While researchers have access to some data and aggregated information, without full data transparency, we see it as impossible to answer many important questions about Medicare Advantage and its impact on Medicare recipients. You see the point? In other words, they don't provide this data, and they're saying we have to make Medicare Advantage plans more transparent. Let's keep reading. They said CMS could also collect data to better understand why Medicare Advantage beneficiaries that are in poor health are more likely than healthy beneficiaries to switch from Medicare Advantage to traditional Medicare, if they can. And MA enrollees are more than twice as likely to switch to traditional Medicare in their last year of life. Why is this switching happening? Why? They're not getting adequate and proper care, and they want want to switch over. Okay, that's going to now bring us then to the third reform that is needed. Again, let's read it. They're saying we need to rein in overpayments to these Medicare Advantage insurers by adjusting the benchmarks and cracking down on deceptive tactics. Let me give you the details of this one. Here's what is reported. Leading government watchdogs. Here's what the Congress people are saying. Leading government watchdogs like MedPAC, the Committee for a Responsible Federal Budget, Congressional Budget Office, the Government Accountability Office, have documented. Now listen, this is staggering to me. These government agencies have documented that insurance companies overcharge the government for the Medicare Advantage plans they run by an estimated $81 to $156 billion per year, folks, per year. Data indicates that companies obtain these extra taxpayer dollars through upcoding, which is a process of adding diagnostic codes to a patient's medical records falsely, so it makes that patient appear more sick and they get more money. Number two, favorable selection, in which insurers recruit healthier enrollees who require less care. And again, a lot of people go on to Medicare Advantage when they're healthy at 65, but the government still gives these insurance companies the same amount of money whether the person's healthy or not. Number three, quality bonus payments, which are based on flawed metrics that have failed to improve plan quality. In other words, insurance companies talk Medicare into paying them more money, and again, it's a flawed system, and they just continue to pay them. And then inflated benchmarks due to induced utilization from supplemental coverage. The point is they get rebates from the government to cover some of these little supplemental things that they offer, the dental, the vision, the hearing, and yet those are underutilized. And so where does the money go? Into the profits of the insurance company. So they're saying this has got to change. Just a couple more statements on this particular item, and then we'll go to number 4, and then we conclude. Here's what they said. Together, these steps that we just talked about could save taxpayers over $100 billion per year. All right, where's that money going right now? To the insurance company's profit margins. All right, now let's go to the last one, and his number 4 is this. Again, let's read it, please. To strengthen the Medicare for everyone, so the Medicare, original Medicare, traditional Medicare system through administrative action. And again, they need the transparency so they can see what's going on. Lowering the Part B premiums. Wouldn't that be wonderful for people as well? Again, people are having to pay more for their Part B premiums because the government needs this extra money to give to the Medicare Advantage companies. Expanding benefits within traditional Medicare. Capping the out-of-pocket cost in traditional Medicare, and increasing the pay to the providers, making sure the physicians are paid properly. Let's read this and then we'll conclude. And here's what they said. In this letter, nearly all of the following actions could be paid. In other words, all these things here could be paid for solely by stopping overpayments to insurance companies in Medicare Advantage system. Doing so would also directly decrease, again, the Medicare Part B premiums by as much as $260 billion over the next decade. We support using the savings from Medicare Advantage payment reforms to expand Medicare benefits, and that's needed to expand benefits for dental and vision and hearing care. These savings could also be used to apply to the Medicare Income Index to the physician fee schedule. In other words, make sure these providers are paid properly. And all this would ensure that all this would ensure that payments to the physicians account for rising costs and in turn allow more physicians to treat those people that are on Medicare. All right. And then lastly, they said this: we applaud your attention to issues in Medicare Advantage. In other words, they're trying to do some things. And we support building on this progress. And they're saying, yes, we've started, but we have a long ways to go. And we support building on this progress by ending delays and denials of care by insurance companies, Medicare Advantage plans, and again, that's the whole prior authorization system, by strengthening transparency efforts, more accountability, more data that the Advantage plans have to deliver, reining in overpayments to insurance companies. They're just overpaying, and we saw the 81 to $156 billion every single year, and supporting efforts to lower costs and expand benefits in traditional Medicare. And they conclude with this, and I will as well. We look forward to continuing to work together towards our shared vision for a comprehensive, sustainable Medicare program that serves patients' needs and not insurers' profits. All right. So I hope they will press on with this. It's a very large industry, very difficult to kind of stop this train, but they need to stop it and turn it around so we can see some great reforms to Medicare.